So of late, we see many women coming with an ultrasound report stating adnexal mass. So what is this adnexal mass? So adnexa is the ovary and the tubes and the surrounding tissues forming a mass. So if there is any kind of a mass in the ovary or the tube, we call it as an adnexal mass. So how do we generally manage this particular situation? So if the mass is going to be in the tube, so which is called as hydrosalpinx, and depending upon the age of the tube and her fertility, we decide on how to manage it. So suppose if the infertility is an issue for that particular patient, then if the tubes are slightly enlarged and if it is forming a mass, then we can just clip the tube and leave the mass for some time. But if the mass is very big, then we prefer to remove these tube, because what exactly happens is that this mass will have certain amount of toxic materials which will keep trickling through the tube into the uterus, and it will not allow the embryo to implant. In such a situation, unless and until we clear the toxic factor from that patient's tube, achieving a pregnancy would be a big challenge. So, but if the mass is in the ovary, say it is an ovarian cyst, then again we need to decide how to manage it based on the age of the women. So if the mass is an younger age group, say adolescent girls or something, then we have to really rule out first a cancer. Same way, if the mass is in a elderly women, in a perimenopausal or in a postmenopausal women, again we have to see whether there is any chance of cancer by doing those markers. So if there are no cancer, then the treatment becomes very simple. Laparoscopically, we can remove only those mass, whether it is a cyst or whatever it is, we will remove them laparoscopically. So, and save the ovaries. There are times when the ovaries also get twisted and they come with a big mass. Even in such a situation, we do not remove the ovary. We just untwist the ovary and remove only the mass and suspend the ovary, so that the function of the ovary is not compromised and it helps for her future fertility as well. So like this, if the woman comes with an adnexal mass, based on what exactly is the problem, we manage them accordingly.